on this episode of Sustainable Horizons.
Not everything needs to be wrapped in plastic, but they want to have this perception of being sterile.
That's devastating that there's that much going on and that many people that walk through those doors, and it's all just thrown away into a landfill.
They've been finding that there's leak/loss rates up to about 95%.
Guess what?
What?
We're back.
Extra long. Gotta love it.
New one for you. Yeah. Feel free to cut it however you want.
Yeah. I like it. Today's topic is sustainability in healthcare. Now, this is a thing that I do for my job. So I'm very excited about this topic because I've got some things for you. I could talk for literally like 4, 5, 6 hours on this, but I try to shorten it down to 20, 30 minutes. So let's see how this goes.
Yeah, quick and digestible. These are also like the topics I think are most interesting and why I think I wanted to start a podcast, because I have my topics too that are just so interesting and I have such a depth of knowledge on that I could literally talk to it for 6 hours to somebody and have a great conversation. And that's what we're trying to bring, I think, to our audience here, is just topics like that with a lot of passion.
Yeah. And I was on a double date last night, and my friend's husband was asking me a lot of questions about my job, and I was like taken aback because I'm so used to like being told to stop talking about this. I was like, I don't know how to answer these, not in the podcast context.
Yeah. Just nice. You need an outlet to kind of get all that energy out on it.
Let's dive in. So, healthcare. I feel like everyone's been to a hospital or doctor's office, so we're semi-familiar with it. But you may not have thought about like the depth of all the sustainable aspects of a hospital in the sense of waste, water, and energy. But today we're just going to focus on waste and energy. There's also a lot of water use, but just those two. So to give you some context, healthcare systems are responsible for 4 to 5% of global greenhouse gas emissions. So that's kind of like a lot, right? 4 to 5%. It's a little shocking.
Totally.
I believe in the US itself, it's 8 to 10%, depending on the year.
That makes sense.
So very intense. But it does make sense when you think about it, because most major hospitals are running 24/7, 365. They have patient rooms, cafeterias, office spaces. Many have on-site laundry. And of course, they will have labs. They have imaging. They have patient rooms. They have operating rooms. There is a lot that goes into these hospitals. And because like also with like the imaging, when I say imaging, I mean like MRIs and CT scans. MRIs are those like the big magnet machines that are rotating. Those things have to be kept on 24/7 because of the way that they are. They have to be kept super cold, which in order for them to keep them super cold, it needs power. So a lot of energy there. And that's just to name most of the parts of a hospital that take up energy. And that's all not to mention the heating, air conditioning for the entire campus. Plus, inside the labs, they have extremely cold chillers for preserving lab samples and research materials, biological samples, things like that. And they also have high heat autoclaves that are used for sterilizing equipment. So when they put in the metal surgical tools, they close down the hood and it's really hot steam, and it takes a lot of energy to produce all that steam.
Those machines, if nobody's ever seen them, they're kind of wild. I worked in a plant lab and we had to sterilize everything because they were working with like gene editing implants and stuff.
Cool.
It's kind of weird whenever I like brought it back there. They're just like these big metal tube type things that are just kind of set up. And like you said, you just roll that door up, you shove it in. It's not very big inside. It's just like kind of insulated really well because it needs to be to like get up to the levels that it needs to, or the temperature levels it needs to. And then you close it and it's kind of intense, and you start it and then you close the door and it's tucked way in the corner because it's also super loud when it does it. So yeah, it's kind of an intense thing.
Yeah, for anyone who's ever worked in a restaurant, it's kind of like those industrial dishwashers, but like a little smaller, even hotter, if you can believe it.
Yep.
So if you've ever touched a plate out of those dishwashers, you've burned your hand.
Yes.
So that's the energy. The other aspect of hospitals I want to talk about is waste. So on average, a single hospital bed produces 33 pounds of waste every day. Based on that figure, that means that more than 5.9 million tons of waste are generated in the US in hospitals each year.
That's crazy.
A lot.
I mean, it makes sense because like a lot of medical needs to be sterile and they're like packaged sterile. So there's a lot of single-use package. The needles are used once. The syringes are used once. Basically everything in a hospital is just used once and thrown out. And you go through so many a day, depending on what it is.
Mm-hmm.
So that's not really surprising to me, but still a lot.
Yeah, because I think, they're obviously throwing away the obvious, like bandages, gloves that were used for doing things or getting your prostate checked, any sort of human biological samples and like any other potentially infectious waste. There's about 8 or 9 types of waste in a hospital. There's your typical trash, recycling, organics. There's the infectious waste, which is anything that could, as it says, infect other people. There's radioactive waste. There's sharps, your needles. There's pharmaceutical waste. And then there's also these things called dual waste and special waste, which is usually just like a combination of the previous categories. I think I'm missing 1 or 2, but you get the point. There's a lot of different types of waste. And I'm glad that you brought up the single-use ones because like you said, every single thing is wrapped in plastic and fairly thick plastic film at that. You listed a couple of these single-use items. You want to guess some more that you may not think of that are getting trashed?
I know their bedding gets washed because that would be ridiculous. What?
Nope. Blankets and pillows will get thrown in the trash quite often.
I mean, I guess I get pillows because like
you drool,
you wash them and they're not.
Yeah.
And it just like it's never the same after, so that sucks for the next person. But a blanket, like that's so washable.
Mm-hmm. Sheets. This is one that really blew my mind. You know those blood pressure cuffs that they'll put on you?
Yeah.
Trash.
In a hospital?
They're marked as single use. We'll get into that in a second.
But I hope not in like family medicine. No.
Yep. Most hospitals have adopted this policy of, so manufacturers will mark their products as single use, and then hospitals, because understandably, they take an extremely cautious approach when it comes to any potential contamination, they will use that once and throw it away. It's a major problem. Luckily, there are some companies out there right now that will buy back these products or take them back, and then it's basically like refurbishing them and recertifying them to be reused. But that's a newer thing, and that's slowly growing, and it's a little more expensive than just buying and dumping. It's heartbreaking. It's truly shocking.
A little bit, yeah.
Mm-hmm.
I'm a little devastated at that fact because like you said, they run 24/7 and they're so large. Like in Minneapolis alone, there's 3 different hospitals at least, and then you go to the submetro and you probably got 50, like they have to be everywhere close enough so that people can get the life-saving help they need in a timely manner. That's devastating that there's that much going on and that many people that walk through those doors and it's all just thrown away into a landfill too.
It's also surgical instruments. So in operating rooms, they will buy these kits of surgical tools that will have 10 to 20 tools in them. They come prepackaged, wrapped in plastic. They will open it up. They will use 3 or 4 of those devices. Trash. The whole thing. It's also a policy that, let's say in a nursing home or if you're in like a little more long-term care in a unit, anything that is in that room when that patient leaves, trash. That is just out there. It's a real problem. So I'm happy that you brought up like the blankets and pillows and stuff because I want to talk about laundry. It seems fairly simple.
You would think.
Yep, you would think. So one of the problems and solutions in this is that hospitals have been making the switch away from having on-site laundry. Can you guess why they would do this?
Maybe better quality control because it's a facility built directly for laundry and maybe higher steam levels or something to sanitize better.
Oh, you'd love to think that, wouldn't you?
I would hope.
Like most things in this world, at least in this country, money. Money is the answer. So washing bed sheets, blankets, pillows, towels, and scrubs on site means that they have to pay for the operations and maintenance of those washers and dryers, which includes the cost of water, of the energy, and of the staff to run it through and maintain those machines. And also a lot of these hospitals were originally designed with the laundry in them. But we have to remember that hospitals are a business. And how do they make profit? Patients. Getting rid of on-site laundry means that they have more space for patient rooms. So they can just increase those dollars.
We have a big healthcare issue in this country between insurance and the cost of what it costs here to just go to the doctor in general. Insulin prices, just everything is kind of out of whack. I think one major issue and kind of stems all of this is the for-profit model. You should not be able to profit off of people suffering. That's when you have it should be nonprofit only is how they should operate. Like it should be mandated, not state run necessarily. Like I don't think that's better, but like mandated that everything is a nonprofit and then you're not overcharging. And it shouldn't be $3,500 for a bed in the ICU or not the ICU, the ER for the night as you broke an arm or did whatever. That's a lot. That's crazy.
Yep. Yeah, all of those things that we just talked about with just the laundry systems, all of that has incentivized hospitals to increase their purchasing of these single-use products. So like those like paper sheets that they'll use, paper gowns, and they'll just be disposed of. And they will contract out laundry services for any remaining laundry that needs to be done. And remember when I threw out the number of 4 to 5% of global emissions and 8 to 10% in the US, healthcare accounts for a lot of emissions. So not only is this switch away from having on-site laundry creating more single-use waste, but it's also adding more emissions into this equation by having laundry being picked up by contractors, transported to their other facilities, and then brought back. It's just adds to it. It's not a huge portion, but just enough to be significant.
Yeah, they're not going down. They're going up.
Yep. And so another side that I want to talk about is we talked a little bit about sterilization. So a lesser known but widely used single-use material is this thing called bluewrap. Beyond being blue and wrapping things, what it is it's this spongy plastic material that is used for the sterilization of surgical instruments. So it's sort of like this one-way membrane that allows the steam in those autoclaves to reach those surgical instruments to decontaminate them and then allows them to be transported to whatever room they need to go to. The problem is that bluewrap is single-use. Practice Green Health, which is a major organization that's trying to help green the healthcare industry, estimates that 255 million pounds of bluewrap is thrown away every single year. 255 million pounds of film, basically. It's not only is that a crazy high number, but it's also kind of a nightmare to handle from like a waste management perspective because of its spongy character. It doesn't compact in compactors, and therefore it's also an inefficient material to transport because of its lack of density. So guess what this adds? More emissions to the equation, because now they have to have more trips to the hospital to pick up their trash because this bluewrap is taking up so much space. And so they're transporting air, which is supply chain 101. Don't do that.
I'm thinking so we talked about, we did our ocean special and we talked about pollution in the ocean and how the Great Pacific Garbage Patch is a huge thing. And our single-use straws and things like that definitely are a problem. And is something we should work on as consumers to buy less, have more reusable things, blah, blah, blah. But when you go out into the ocean, a lot of these things out there are the fishing industry's ghost nets, the things that they just cut loose because it got caught on something or whatever. It's old, so they just dump it off. It's an industry's pollution, mainly in our oceans, that's making up a lot of the percentage of that. Feels kind of similar on this front for hospitals a little bit too. Because at home, you don't do any of that stuff.
Even if you're like saran wrapping everything or something.
Yeah, and even like you do insulin and you have your own needle and stuff like that. But like that at a single level, it's just not anywhere near the quantity that these hospitals do. And then try to profit off of. So they're like, yeah, single use is better. We're not going to try to reuse this or redo that or sterilize it, even though we have the machines.
But to hit on an economics point, there is a solution for the blue wrap problem. And that is this thing called sterilization. Containers, aka hard cases, is typically what they're referred to as. And these are, simply put, reusable metal boxes that operate the same way as the blue wrap. Put them in the autoclave, steams them, and you can transport them safely. The cons of these hard cases are that they do have a higher upfront cost. You need space to store them.
Taking up patient beds. Can't do that.
Yeah, exactly. That's exactly the point, is they don't want to take up a whole room to store metal boxes that a patient, aka a profit point, could be in. But Mintap did a study at St. Luke's Hospital where they found that if that hospital purchased 224 hard cases, they would be able to reduce 5.4 million tons of blue wrap waste and save $100,000 annually. If they did this, it would have a payback period in less than 2 years.
That's insane.
So it's kind of a no-brainer.
It's like you're going to save that much. Is that not... It's still likely less than what that room could probably bring in with a patient, unfortunately, because of the cost of everything. In a year, people coming in and out, and it's $2,000 a pop. That's damn near $1 million a room, on average, if that's conservatively what you want to call it. But that's insane.
Yep.
And it makes sense. Like, that's a sustainable solution that you go, cool, it's got a quick payback period. Because that's one thing about sustainability is their payback periods are often a lot longer than that.
Yeah.
Yeah. So that one's good.
And so that's one of like the more in-depth solutions. Laundry, back on-site laundry. But there's so many other aspects that we didn't get into. There's cafeterias. They have a lot of food waste. If you go to one of the hospital cafeterias, they'll often have like a salad bar. They'll have pizza out. A lot of that food gets thrown in landfill, and a lot of hospitals don't have organics. That's a problem. They use a lot of single-use plastics in the cafeteria as well. For the medical device manufacturers, with everything being wrapped in plastic, not everything needs to be wrapped in plastic the way it is. But they want to have this perception of being sterile. So that's what they do to look better. And also to the point earlier about those kits that they'll use in operation rooms. You don't need to make a kit of 15 different
make them
surgical instruments.
Individual.
When you know that for I don't know the names of surgeries, but like for the removal of an appendix, for example, let's say they only need 4 instruments. That is a super common surgery. You know what you're going to need for
Make
that.
an appendix package.
Exactly. Is that very simple solution, or allow hospitals to order custom packages. It's not really a thing. There's also the issue of anesthetic gases, this is something that I've been working on recently. There are 3 types of anesthetics that will be used in surgery. There's desflurane, isoflurane, and sevoflurane. Anesthetic gases are extremely potent greenhouse gases. So these numbers are how many times more potent they are than carbon dioxide. Desflurane is 2,500 times more potent. Iso is 510, and sevoflurane is 130. All of these are substitutable. I'm not a medical professional. I can't tell you what to use, but I can tell you that your carbon footprint will be much lower if you use sevoflurane. So that's another thing that hospitals and anestheticians can do to reduce their greenhouse gas impact. And not only that, but in these hospitals, if they have what they call central line systems, so that's if you have your gas canisters in a room in a hospital, and then those gases get piped throughout the whole hospital, they've been finding that there's leak/loss rates in pretty much all of those. That's about 95%. Insane.
So 5% gets through?
Gets through to the patient. Yep. So that's a number that's just ridiculous. Because I would say in like a normal compressed gas system, 5 to 10% is like a common number that you'll find. 95, like it's in the 90s, 80s to 90s. It's insane. So because of this, a lot of hospitals are moving to just fully decommission central line systems and move to carts. Problem with those carts is they take up space. Then there's our space issue again.
Yeah.
In those systems, you get back down to a more common loss rate of 5 to 10%, and which is acceptable.
Considering it was 95, that's a win.
And
especially when it's 2,000 times.
Potent greenhouse gas and expensive. These gases are crazy expensive. And so there's another area. There's also all of your other things that we mentioned earlier. There's the chillers. There's air conditioning and heating, HVAC. There's water use throughout the facility. There are so many aspects to hospitals because in many ways they are their own city to a degree. And there are a lot of aspects to hospitals that can be improved. Fortunately, most hospitals now have a sustainability staff, or at least one person who's focusing on this. That's a growing trend. I believe it'll stay because, like we just said, it saves the hospitals money. The proof is in the pudding and not the one in the cafeteria. I'm going to make a great dad. So yeah, I mean, there is hope. There are people working on this and there are solutions out there. A lot of this is also kind of like what we talked about is the culture shift of hospitals really want to show how sterile they are, that they go too far and become extremely wasteful. And a lot of what these sustainability coordinators and directors at these hospitals are trying to remind the powers that be are that environmental health is human health. And at the end of the day, if you can improve your operations, you're improving your patient care.
When we think of all this single-use plastic, my head jumps to compostable plastic. I don't know if it's as airtight, but it feels like a logical step that could be explored if you have to have, because I get it. Some of those things definitely need to have the sterile plastic, one-time use, you rip it open, you slap it on, and you throw it away. I get that. That's just probably a thing that we're not going to be able to avoid. But can we rework the system where it's compostable and they get greens bins on these campuses, and that's where a majority of their waste cycle goes to, along with all the food waste and things like that. And, bedding, if it's made out of natural fibers and you're going to throw it away, okay, compost it, cool. Put it back down to what its base components are and we'll recycle it that way. It feels like in an industry that's going to have a lot of single use likely forever, just because of the nature of it, figuring out a single use that is more circular in that respect, or at least can be recycled better and not just thrown into the dump and landfills everywhere.
Yeah, you're absolutely correct. And the problem was that there was a lot of momentum on this in the last 10 years, but then COVID happened and masks and gloves and all these safety equipment, which especially in hospitals, it was needed. I'm not going to argue that. Human health comes first.
Of course.
But it kind of derailed a lot of the momentum on these sustainability issues, and we need to bring those people back. And a lot of the sustainability stuff did get fired because hospitals just viewed it as overhead. They're like, all right, we don't need this. We just need to get patients in and out and cared for.
And they went into kind of survival mode a little bit, being overwhelmed.
Yeah.
Yeah, that's wild.
So that's healthcare sustainability. That's part of what I do for a living.
I learned a lot. That's fun. It feels like a field in sustainability with a lot of opportunity. If you're interested in healthcare at all and patient care. It's like, and sustainability, here's your angle. Get into a hospital and try to make them more efficient, and healthcare and patient care will just inevitably get better because of the things that you're going to implement in these hospitals.
Yeah, I found it fun because growing up, I wanted to be a doctor or work in sustainability. And in this way, I kind of get the best of both worlds.
Yeah. A little bit. Yeah. Cool. Yeah. No, I had fun. This was very informative, kind of eye-opening, which is always fun in sustainability when you're kind of shocked by how bad it is.
Yeah.
Until next time.